is when gas exchange takes place. So external respiration is between the blood and air. So that takes place at your alveolar capillary membrane. Okay, so that is where the ambient environment provides that oxygen. So we have the highest pressure of oxygen in the ambient environment. Through our muscles, in our respiratory system, we create a pressure gradient, and then ventilation takes place. So that's when we actually pull, that's the physical movement of pulling air down into our lungs. And then right there at the alveolar capillary membrane, that's where the nice blood comes through, the deoxygenated blood, and that's where the lungs supply and kind of act as a reservoir for that oxygen for the blood to pick up. Whereas internal respiration is the gas exchange between the blood and the tissues. So this is happening through all of our body, through all of our systemic tissues. And so it's also there where the tissues is where carbon dioxide gets created as a byproduct of cellular respiration. So then carbon dioxide gets picked up from the tissues, internal respiration, also gets carried, gets emptied into the lungs, and once again, through physically ventilation, gets exhaled. We have two main vascular systems in our body: the pulmonary vascular system and the systemic vascular system. So the pulmonary vascular system takes place from the pulmonary trunk, right from the right ventricle, to the left atrium. It's where external respiration takes place. It will respond to sympathetic innervation. It's right there in the medulla, which is in our brain stem, where that vasomotor center controls the number of sympathetic controls and monitors the number of sympathetic impulses. And the blood pressure in our pulmonary system is 25/8. So that's the systolic pressure, the higher pressure of 25 millimeters of mercury, over the resting or diastolic, resting or refilling phase of the cardiac cycle, which is only 8 millimeters of mercury. So if you compare that to our systemic circulation, the systemic is anywhere from the aorta to the right atrium, so most of our body. That's where internal respiration takes place. It's also through the vasomotor center in the medulla in our brain stem, where sympathetic innervation is both controlled and responded to. The blood pressure in the systemic system is much higher. 120 is the systolic pressure, over 80. So that's much higher. It's approximately 10 times greater in the systemic circulation as compared to the pulmonary system. And that's an absolute function of the distance the systemic circulation has to travel. We need a much higher pressure to travel a further distance. So the pulmonary system only travels is made up of where the vessels have to travel through the pulmonary system. So once again, that's going to be a much lower pressure. So this picture depicts the two different systems where our pulmonary arteries and our systemic arteries have a much different blood pressure. And it's that blood pressure that creates a pressure gradient to move the blood from one area to the other. Very similar to our respiratory system, where we needed to create those pressure gradients, the transrespiratory pressure to bring air down through the tracheobronchial tree, and then the transpulmonary pressure to keep the lungs inflated. So same with our respiratory system. We have to have the two different pressures to create that pressure gradient to move the blood. So here in the systemic system, 120/80, and that's just our blood pressure. We're not used to saying our systemic our systemic driving pressure, but that really is what it is. So approximately 120/80 in our systemic circulation and approximately 24/8 or 9 in our pulmonary system. And that's once again just a function of the greater distance that our systemic system has to go through. So exactly the same in our respiratory system, we have to look at how pressure, flow, and resistance have an influence over each other. So in general, when we talk about a hydrostatic pressure, we talk about a pressure exerted by fluid. So in the cardiovascular system, that's just the pressure created by blood in the blood vessels. And that's generated by our heart muscle contraction. And that's just called our blood pressure commonly. Hydrostatic pressure is the same thing as when we talk about our blood pressure. So resistance, once again, just talks about how difficult it is for blood to flow between 2 points at any given pressure difference. Very similar to when we talk about blood flow versus airflow. So flow rate is the change in pressure over our resistance. So flow rate is directly proportional to the pressure difference and inversely proportional to the resistance of blood flow. Therefore, if we have a lot of resistance, a lot of times created by the atherosclerosis or the plaque that builds up in our blood vessels, it's going to take a lot higher pressure to get that blood flow to move through the whole body. So more resistance requires a greater blood pressure to pump the blood through the body. This is the exact same concept as we learned in the respiratory system. So our respiratory muscles, or our muscles of our diaphragm and our intercostals, have to create a much greater pressure gradient, much greater pressure difference or gradient to move airflow into our tracheobronchial tree if there's a lot of resistance. And resistance in our tracheobronchial tree a lot of times comes from extra mucus or from bronchoconstriction because of an inflammatory attack, because of we came into contact with an antigen that our body's allergic to. It can come from extra such as a breathing tube or anything extra that's put into the tracheobronchial tree that causes resistance or causes a lower radius throughout the airways or tracheobronchial tree. So once again, more resistance, more pressure to move either the blood or the airflow. So the main function of the cardiovascular system is to maintain adequate blood flow to all the organs. So you can see here our brain takes up quite a bit of blood flow, and this is at rest. Our heart takes 4%, our muscles 20%, our skin 9%. Our kidneys and abdominals take up a lot of blood flow at rest. So our kidneys 20%, our abdominals 24%. So you can see why if we're having heart failure and having a hard time delivering that blood, our kidneys here, they take up so much at rest, they tend to fail if our heart fails as well. So the main function of the respiratory system is for gas exchange. So oxygen to be provided to the blood and for carbon dioxide to be taken from the blood and exhaled out. But our cardiovascular system's main function is to maintain adequate blood flow. So therefore, if we have inadequate gas exchange from our respiratory system or inadequate blood flow from our cardiovascular system, these organs here are really going to take a hit, meaning they're not going to get what they need and they could have dysfunction. So if we have something like shock, where there's an inadequate blood flow to all of our organs in our body, we could have multi-organ failure. Okay, so we're going to talk about the cardiac cycle. And the cardiac cycle is consistently taking place. It's an autonomic function, meaning an automatic function in our body. It's very influenced by our sympathetic innervation, so our sympathetic system. And there's two main portions of the cardiac cycle. Systole happens when there is a ventricle contraction. So once again, those ventricles are those high pressured muscles that really create that contraction, where diastole is when the ventricles are resting and refilling with our blood. So you learned in fundamentals class that the average heart rate is between 60 and 100. So absolute average would be about 72 beats per minute. We spend most of that time in diastole, so most of the time resting, and then one good fast, hard pump in systole. So systole is when the blood is forced into the pulmonary artery and our aorta. The systolic pressure is the maximum force generated during the ventricular contraction. So in the systemic system, if you measured that pressure, it would be about 120 millimeters of mercury. If you measured that in the pulmonary system, it would only be about 25 millimeters of mercury, because once again, there's much greater distance to travel in the systemic circulation. In diastole, it's where the ventricles relax, the arterial pressure drops. The diastole pressure is the lowest pressure remaining in the arteries. So that pressure is generally around 80 in the systemic circulation and around 8 millimeters of mercury in the pulmonary circulation. So once again, about a 10 times greater amount or force in the systemic circulation versus the pulmonary circulation. Now, of course, I'm going to ask you to compare that to the respiratory system. So if we can think back to when we're talking about one breath cycle versus a cardiac cycle, when we talked about the peak pressure, it was the greatest amount of pressure generated by our muscles to overcome airway resistance to move airflow into the tracheobronchial tree, where our end expiratory pressure is similar to our diastole pressure. And that is where our lungs are just filled with a minimal amount of air, enough to keep them open. And we call that sitting at functional residual capacity. And that's our baseline pressure. And so both with systole and diastole and peak pressure versus our baseline pressure, we spend about twice the amount of time in diastole and our end expiratory pressure versus our peak pressure or our systolic pressure. So once again, systole is when the blood is forced into the aorta and pulmonary arteries. Blood is then ejected from each ventricle, and that's called our stroke volume. And then in our diastole, it's where the valves close, the ventricles relax, and then the AV valve, so your mitral and your tricuspid, open and blood flows back into the ventricles. So to calculate the mean blood pressure, and mean just means the average blood pressure, we look at systemic blood pressure plus 2 times the diastolic pressure, and we divide all of that by 3. And the reason we do 3 is because we're looking at 3 parts: 1 part of systole and then 2 parts of diastole, because we spend more time in diastole. So let's look at an example of our systemic mean arterial blood pressure. Our systolic pressure here is 120 millimeters of mercury. Our average diastolic pressure is 80 millimeters of mercury. So if we plug the numbers in here to this equation, 120 plus 2 times 80, divide all of that by 3, and we get approximately 93 millimeters of mercury. So if we would do that for our pulmonary circulation, we said that the average pulmonary circulation is 25/8. So we can do that here on this whiteboard. So here, I'll put it up here. So our average pulmonary blood pressure is 25/8. So if we use this same equation, systolic pressure, 25 plus 2 times our diastolic pressure divided by 3. So if we want to first look at order of operations, we could say 25 plus 16 divided by 3. And if we do that, we'll take our calculators here. (25 plus 16) divided that by 3, and we get 13.6. So we'll just put that into a whole number. So then the average pressure in our pulmonary circulation, if you guys can see this, is approximately 14. So once again, in our systemic blood pressure, the average is 93. And in our pulmonary blood pressure, the average is 14. And once again, that is just the fact that the systemic circulation has a lot further to travel. So another really important physiologic process that our body does, and it's called a feedback loop, is to maintain an appropriate blood pressure throughout our body. So one of the ways we do this is through our baroreceptors. Our baroreceptors are special stretch receptors that respond to pressure. And of course, baro means pressure. They're located in our medullary cardiovascular center, and they're special neurons that process the arterial baroreceptor signal. And then that will tell our sympathetic system to respond appropriately. So these receptors are located in both our carotid bodies and our aorta. Both of them respond to our cranial nerve. So in the carotid, it's our 9th cranial glossopharyngeal, and then in our aorta, it's our 10th vagus nerve, 10th cranial nerve. Both of these signals travel to the medulla, and they will have an increase in baroreceptor response or a decrease in our sympathetic response. And that is based on what our needs are in our body to maintain. So let's take an example here. Let's say that we get the flu, and let's use just the common flu, the seasonal flu. And commonly what happens in the flu is we get really bad vomiting and diarrhea, as well as just the inability to want to eat. And then if we do, it's really hard to hold liquids down. So then we get dehydrated. Well, when we get dehydrated, the blood volume decreases. That will, of course, decrease our blood pressure. So let's look at number 1 here in this little cycle. So due to vomiting and diarrhea, our blood pressure drops. Because of that, there's less firing in our cardiovascular center, in our brainstem, in the medulla. Therefore, our body says, hey, let's increase our sympathetic activity. And because of that, our sympathetic activity will increase our heart rate. It will increase our myocardial contraction, and then it'll cause vasoconstriction in both our arteries and veins. And because of that, it will increase our cardiac output. It'll increase our resistance, and therefore it will increase our blood pressure back to normal. So it's just our baroreceptors in our body are constantly doing this feedback loop to maintain homeostasis and keep our blood pressure where it needs to be to deliver the appropriate amount of blood flow to the organs.